So, yep, thanks for joining today. My name is Brad from Motionworks Careers. And yep, I'm here today with my guest, Emiko Nakajima, who is a medical interpreter at Sapporo Higashi Tokushukai Hospital up in Hokkaido. Emiko, thanks for joining today.
Thank you for inviting me today.
Yeah, so we've had a couple of
Mhm.
informal conversations and video calls and those kind of things. And yeah, I was just in general, I was quite interested in what you do.
Mhm.
I'm not all that familiar with medical interpretation and those kind of things, but
Mm.
I was quite interested in your career and those kind of things. So
Mhm.
this interview is really just to highlight a little about your career and what you do,
Mm.
and then also a little background in terms of um, where you work and also freelance jobs in
Mhm.
general that are available within your industry there. Yeah, so for starters, can you just tell us a little about
Mhm.
your background, what you're currently doing, and also maybe kind of how you ended up doing medical
Mhm.
interpretation?
Okay, so I've been mainly working as a medical interpreter for the last 6 years at a hospital, and then so until today, I have worked in two hospitals in Hokkaido. And so I will tell you about my like detailed history of my career later. But in a nutshell, like I can say, so mainly I've been employed by a hospital, and whenever I have a patient who doesn't speak Japanese, I attend them and then I interpret for them. So it starts from the reception, like they first do the check-in, and then we take the questionnaire. And if they need a test, they also take the test, and then they see a doctor. So I also interpret for them. And at the end, they go to the payment desk, and also I have to explain them about the payment. And then finally, when they receive the medicine, I also explain how to take the medicines for them. So as long as they stay inside the hospital, it's my job to take care of them from the beginning to the end.
Wow. Okay,
Mm,
that's a big responsibility and quite
yes.
quite time consuming as well, it seems.
Uh-huh. So like usually, so I've been working as a Japanese English medical interpreter. But for example, usually for one person, since it's the hospital, usually they take about 3 hours to finish, or like they usually spend whole time in the morning to finish everything.
Right.
So yeah, it's very tiresome. Not really tiresome, but like how can I say, like I cannot leave them until they finish. So
And what's the process? I mean, I'm going to
uh-huh.
show some data from your hospital a bit, but
Mm-hmm.
like for example, in the morning, like
Mm-mm.
how many patients or customers can you actually support it at one time? Is it one time one day, or
Mm-hmm.
like is it like are you doing
Mm-hmm.
multiple like a regular
Uh,
doctor?
so it really depending on the day. So for example, sometimes only one patient come for one day, but usually they come, I don't know why, but they come together on the same day.
Right.
So in that case, like sometimes I have to take care of three patients at the same time. And like if they go to the different departments separately, I have to run from the downstairs to the third floor and then second floor. And like and then like medical staff call me like, we need an interpreter, so please come. Then I have to run to them. So it's really like it's like I am doing like exercise.
Okay.
Yeah,
It sounds
sometimes.
like a
Yeah.
full on medical kind of staff. And are
Mm-hmm.
you kind of we may get into this a bit later, but like, are you
Mm-mm.
kind of with the nursing team or with the doctors, or like how are you assigned and how do they organize your shift and your work flow?
Okay. So there is office department called International Medical Support Office in this hospital. So in this office, all the staff are interpreters. So my hospital has Chinese, Russian, English interpreters. And in total right now, maybe 10, there are 10 staff. So, but as how can I say, like as job title, we are regarded as clerk.
Okay.
So our main job is, of course, like interpretation. But when we don't have the patients, we also do translations. And if, for example, if there is a Japanese patient who, let's say, who are looking for, I don't know, like bathroom, or I don't know, looking for where to go to the department, no?
Right.
In that case, like we also have to assist them.
Okay.
So yeah, we actually do a lot of jobs, I think.
Quite a busy job. Yeah, and one thing I wanted to share here on our screen here was, so this is your actual hospital website.
Yes.
And you mentioned that this is the English website, which you helped to create. So nice job with that. Definitely lots of information there. Yeah, one of the things on this page that I obviously this is all the departments, so that's quite a lot of areas that you cover. And then also I wanted to look at some of the data here. So, the number of international patients. I guess this was last year, but looks like Chinese patients are probably one of the highest, looks like. And then you have quite a range of nationalities. And you said in general, the hospital supports English, French. You said what other, Russian?
English, Chinese, and Russian.
Russian, okay.
But also, because like we also have a lot of patients who don't speak these languages.
Right.
So for them, we also prepare a remote interpreter service.
Okay.
So
interesting.
So we have quite a lot of languages available.
Okay. Wow, that's a well structured platform that you have there for everyone. And looking at this one as well, the number of patients, and this is only your hospital in Sapporo, right?
Yes.
So that's quite a lot. I mean, where do you see the trends going? And obviously year on year, it's increasing. Obviously, it's seasonal. It depends. But yeah, how can you interpret some of the data of like what's the increase? Is that just in general the number of foreigners in Hokkaido or in Sapporo? Or is it seasonal, or what's the reason for the upward trend?
So mainly we have more patients in winter because
probably more accidents as well, I
yes,
imagine.
exactly. So usually because it's Sapporo where we have snow, so usually except for residents, usually tourists come to Sapporo or Hokkaido in winter to enjoy snow and skiing, snowboarding, like any winter activities. And many of them are actually from like Southeast Asian countries where they don't have snows. So unfortunately, some of them like just fall down on the road and they get fractures, and then they come to my hospital. So
and is that like one in terms of the area? Is that one of the larger hospitals, international hospitals in the area, I guess?
Yes, this hospital, I think now there are some other clinics that prepare the full-time interpreters, but until recently, this hospital is the only one which actively accept non-Japanese speaking patients.
Right. Okay.
And so if you see this graph, obviously like during COVID time, we had much less patients because we also had less tourists from overseas.
Right.
But even if so it's not shown on this data, but before COVID, I think it was around 2,000 patients per
Yeah.
year.
So
And
this is
then
about
now
average
it's
from
increasing more.
2023.
Mhm.
Yeah.
And I feel like even in summer, we have more tourists recently.
Hmm.
So of course, like in winter is our busiest season,
Right.
but we are also having more patients in summer as well.
Okay.
Mm-hmm.
And in terms of like some of the types of injuries or illnesses that you deal with, I mean, are most of them, I guess,
Mm-hmm.
like ski related, or are there more
Mm-hmm.
like serious illnesses? And also
Mm-hmm.
like how much medical knowledge do you need as a medical
Mm-hmm.
interpreter to like
Mm-hmm.
kind of assist
Mm.
with the translations in terms of medicine or
Mm-hmm.
illnesses and those things?
Mm-hmm. So when we say non-Japanese speaking patient, it can be divided in two. One are resident, another is a tourist. So, like around Japan, we already have the certain amount of the residents.
Right.
So in Sapporo, we also have fixed amount of residents. So um, since this hospital is the only one which has full-time interpreters, and also, how can I say, foreign patient-friendly hospital. So they also tend to come to this hospital.
Right. So you're kind of
And
known in the area for
uh-huh, uh-huh.
assisting.
Yeah, and since Sapporo or like Hokkaido is very small, like they just like share the information between patients. So like like one patient recommended this hospital to another, so this person comes to hospital, and if they feel like it was good experience, they also share the information. So it's like expanding
Right.
every year.
So go
Uh,
there, ask for Emiko. She's
mhm.
good.
Yeah,
Yeah.
actually, it also happened.
Can they actually request, or what's the protocol for that? Like,
I mean, they can ask, but for example, if I am available, of course I go to the patient. But
right,
like
right,
if I am already busy, or like if another interpreter is busy, then like, I'm sorry, we cannot prepare a miko. So please understand. But yeah, definitely we need medical knowledge because we have to also interpret what the doctors explain to the patients. And there is no ending in this job.
right,
So like because um always the medical information is updated. So we also have to follow them.
right.
So even if you feel like, I know a lot of things now, it doesn't really mean like there's like you can stop learning.
Okay, so you always need to kind of stay updated and current with
Exactly.
medical terminology and
Mm-hmm.
medical profession in general, I guess, and
Uh-huh.
illnesses and those things. Yeah.
Uh-huh. But also because I think this is the difference between in-house medical interpreter and freelance interpreter.
Right,
If you work inside a hospital, you have to know not only medical knowledge, but also about, for example, speaking of Japan, you need to know about Japanese healthcare system.
right,
And also we have the national insurance. So we also have to know about like what kind of benefits the patient can receive.
right.
So this kind of knowledge we also need. And I'm certain that this information doctors don't know.
Right, right. So that's kind of a good kind of collaboration in terms of
Mm-hmm,
the medical care that they're getting, and as well as the information that they're getting as well. So,
mm-hmm, mm-hmm.
okay.
Yes.
Yeah, and that also was going to lead me to, in terms of certified, like you're a licensed
Mm-hmm,
medical interpreter, right? So
mm-hmm,
are there different levels of license, or is there
mm-hmm.
only one? And yeah, can you kind of explain about that?
Mm. Okay, so in Japan, unfortunately, there is no national license still. But there are I would say there is one certificate that is accredited by one organization, but this organization is also designated by the like Ministry of Health, Labor and Welfare in
Right.
Japan. So among medical interpreters, it said that this certificate, this qualification is can be regarded as national license.
Okay. And you said
It's
like
in
there is a difference between medical interpreters that are in working in hospitals and ones that are freelance, right? But both
mhm.
need the certification.
I mean, it'd be better if you have, but it doesn't mean like you have to have.
Okay.
Even if you don't, if even if you are not certified, you can still work. I mean, you can call yourself as medical interpreter.
Okay.
So, but for example, of course, like if like if the client can see that you are certified, maybe they can feel more relieved or like
Right.
they
Right.
can trust you more.
Right. And
Yeah.
what are the qualifications or kind of skills
Mm-hmm.
needed to be a medical interpreter? I mean, aside from
Mm-hmm.
just certification,
Mm-hmm.
uh, what else? What are some of the main
Mm-hmm.
qualities that you need to be a medical
Mm-hmm.
interpreter?
So for this certificate qualification, there is two tests. One is basic, another is advanced. So basic, of course, like they only require you to know about like some basic medical knowledge.
Right.
So, and also to work as a medical interpreter, they also assess how you behave as a medical interpreter. Because we are, I think it's everywhere, but we are asked to, how can I say, we are asked to keep um personal information, no? We
Right.
cannot disclose to the
Confidentiality.
confidentiality exactly. So we cannot disclose any information about the patient to the third party.
Right.
And also like they for the basic test, they see how you behave as medical interpreter. And when you go to the advanced exam, they require you more um, detailed, like detailed medical knowledge that I think only nurses or doctors know. And also, you are required to, for example, like it's already like, the condition that you have to act like a medical interpreter, but more like the examiner assess like if you are taking notes correctly
Right.
or if you can interpret as it's said. Does it make
Right.
sense?
Right. Like accuracy of the
Yes.
interpretation and those things.
Mm-hmm.
Yeah.
Mm-hmm. So so actually I have the advanced one. I took the advanced one and
Okay.
fortunately I could pass it. But to take this exam, I bought some textbook that is for actually nurses. So, so I every day I studied with this textbook, and I also bought some books that is about muscular system or physiology.
Wow.
And yeah, I try to remember as much as possible. And then
So on top
finally,
of the medical knowledge, you also need to be able to translate that
yes,
and
yes,
interpret
yes,
that.
yes. Yeah,
Wow.
so like there are a lot of things that you have to remember. So yeah, but for me it was very fun because to be honest, I really like to know about medical stuff.
Hmm.
So for me it was not, like suffering, but more like enjoyment.
Right.
Like every day I come to know like something new that I didn't know. So I could feel like, oh, I am growing up. You know?
Nice.
Mm-hmm.
And what is it? I mean, in terms of career progression, like you
Mm-hmm.
mentioned some of the opportunities, freelance or working internal in a hospital.
Mm-hmm.
Um, But yeah, in terms of the career progression, what's
Mm.
next for you?
Before starting this career, like I decided to become a medical interpreter when I was finishing my university. And then I found one nonprofit organization in Sapporo that provides medical English course. So that's how I started my career. And I am still a member of this NPO.
Hmm.
And from this organization, sometimes I'm dispatched as a medical interpreter. And also, um, as I said, like I've been working in this hospital as medical interpreter. And I feel like among medical interpreter, I think I relatively have more career than others.
Okay.
And if you see inside Japan, there are not many hospitals that hire full-time medical interpreter.
Right.
And the advantage of working as in-house medical interpreter is that we know the hospital system better than
Right.
freelance medical interpreter, unless they have worked inside the hospital.
Right.
So, um, because unfortunately, among medical interpreters, we usually work as a volunteer,
Right.
and it's difficult to get the full-time medical interpreter job inside Japan.
Okay.
So to be honest, I was lucky to get hired by this hospital. And fortunately, I could improve my career. And also like every day since I had a patient, I could also improve my skills and medical knowledge.
Hmm.
And now I feel like, can I say, I feel like this is think that we can improve in Japan. But um speaking of the residents, like foreign resident in Japan, they don't have many choice of hospital that they can go.
Right.
And I feel this is the problem,
Hmm.
and we have to improve.
And
Be-
I mean, do you know the numbers? Like, what's the total number of medical interpreters in Japan in general? And I can't imagine that there are too many in the Hokkaido area, but probably.
I mean,
Hmm.
if we include like volunteer medical interpreter, maybe there are a lot.
Okay.
But to be
Like
honest,
full time paid. Yeah.
I don't know the exact number. And the the minor language has less interpreters.
Right. Right.
So I think we have more English Japanese interpreter. But for example, if we see like Indonesian Japanese interpreter, or I don't know, Vietnamese Japanese interpreter, I think we have much less than
Mm.
English Japanese. And so, and since the number of um the international people in Japan are increasing, definitely there is the need of medical interpreter.
Right.
And
And
mhm.
I was going to ask about the hospitals. I mean, do the hospitals also feel a need to hire more medical interpreters because of this?
Yes. But what can I say? When you see outside the hospital, I mean, like when you see interpreter industry, to be honest, interpreters are not that cheap, you know?
Right. Yeah, because when we think like, I'm more familiar with like for events or something like that, or big
Mm-hmm,
ones, you
mm-hmm,
have
mm-hmm,
simultaneous interpretation
mm-hmm.
or something like that, or interpreters, or even translators. That's more on the written one, not the verbal one, right?
Mm-hmm,
But
mm-hmm.
I mean, is that something that like there is a need for it, and also cost wise,
Yes.
is it cost effective for hospitals to have a large number, or that's why there are more volunteers than than paid ones?
It's difficult to say, but for example, if this clinic or hospital wants to get more patients who are tourists, I mean like who are not resident, who
Right.
don't hold Japanese national insurance,
Mm.
I think there is the potential of, can I say, growing themselves
Right.
by hiring interpreters.
Right.
Because as I said, there are not many clinics or hospital that has
Mm.
interpreters. So,
Well, as a business sense, I guess, I mean,
mm-hmm,
I'm from the US, and
mm-hmm,
when I go, I'm from the US, but I don't
mm-hmm,
have health insurance in the US, right?
mm-hmm,
So
mm-hmm.
when I go,
Yes.
I mean, one time I
Uh-huh,
got I had an accident with my arm. I was on a
uh-huh,
tour, and I wasn't in my state. I was
uh-huh,
driving around on the highway,
mm-hmm,
and I had my arm had some kind of infection in it, right? So
mm-hmm,
I didn't know how much it
mm-hmm.
was going to cost, but I knew it was going to be a lot, but it
Right.
was crazy, right? So I
Uh-huh. I
I
can
went into
imagine.
an emergency room, and
Uh-huh.
they have this triage, right? And
Uh-huh.
everything was fine. They were all well taken care of, and then sent on my way. And then
Mm-hmm.
that's when, all the question marks came up. So I got
Mm-hmm.
medical bills from like
Mm-hmm.
so many different places within the hospital, right? And the
Mm-hmm. Mm-hmm.
total, I had traveler's insurance, but the
Mm-hmm.
total just for an infection in the arm, and I had an IV,
Mm-hmm.
it was almost 10,000 US dollars. Yeah, it's
Wow.
crazy, right? I
Oh
mean,
my
it's
God.
insane. So, that's a great business model,
Yeah, uh-huh,
for
uh-huh. Yeah, 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 yeah.
for uninsured, or
Mm-hmm.
travel insurance. For
Mm-hmm.
tourists
Mm-hmm.
here in Japan, is it
Mm-hmm.
that I don't know how, of course I have the national health insurance and pay the pensions and stuff, so
Mm-hmm.
I'm lucky because the it's what, 30% I think that we have to pay in
Mm-hmm.
the
Mm-hmm.
medical thing. But
Mm-hmm.
for tourists coming in, if they have
Uh-huh.
travel insurance,
Uh-huh.
I mean, do hospitals, I imagine they make
Mm-hmm.
more money on tourists than they
Mm-hmm.
would on
Mm-hmm.
residents. Yeah.
Yes. Yeah, that's how, that's why my hospital can hire the full-time interpreters.
Right.
So so if you're a resident, it's mandatory to hold national health insurance in
Right.
Japan. But for tourists, of course, they don't have this insurance. And for example, if they have the travel insurance, my hospital have some agreement with some insurance companies, like overseas insurance companies.
Right.
So in that case, we just send the bill directly to the insurance company, and they paid for the
Okay.
patients.
So
Mhm.
same as my traveler's insurance
Uh-huh,
that I
uh-huh, uh-huh.
negotiate. Yeah.
But like usually these travel insurance companies, they are not Japanese companies.
Right.
So the difficulty is like, since I can speak English, it's no problem for me. But like usually like the receptionists or accountants, they are Japanese who don't speak like other languages, but
Right.
only Japanese. So it's difficult to, like contact with the insurance companies. So usually we don't accept, how can I say, we don't,
Overseas
like
insurance
we
or
just ask the patient to pay upfront
okay.
and ask them to make a claim by themselves to their insurance companies. Unfortunately, some companies are not really trustable, so
Right.
they just don't pay
Right.
the
Right.
medical fee. So to avoid this situation, usually we ask the patient to pay upfront.
Right. Right. And it's
Mhm.
safer for both parties. It might be more
Yes.
expensive, but it's
Uh-huh,
probably
uh-huh.
safer in the long
Mm-hmm.
run.
Mm-hmm. And to be honest, can I say, because for non-national insurance holder in Japanese medical system, so if you are a resident, you only have to pay 30%.
Right.
But recently, if these hospitals are like they tend to accept foreign tourists, I think they usually put double.
Okay. Right.
Uh-huh.
So it it also depends on the clinic that you go to, right?
Uh-huh.
It's
Uh-huh.
just like anything, right? You're
Mm-hmm.
yeah, even for me, like, how what when I was charged like 10,000, it was crazy, right? Like
Mm-hmm.
where are you getting that number from? Right?
Mm-hmm.
Right. But
But
luckily my insurance, the travel
mm-hmm.
insurance covered that.
Uh-huh.
And
Uh-huh.
yeah.
So thanks to this system, we interpreter are paid,
Right, right.
So because someone has to pay for the interpreters.
Of course. And that's a valued service, right? Especially in a
Mm-hmm.
country where you don't speak
Mm-hmm.
that language. I mean,
Mm-hmm.
even for me, I'm a resident, but
Mm-hmm.
I've been to many hospital visits, but
Mm-hmm.
I speak enough Japanese,
Mm-hmm.
not to need an interpreter, but
Mm-hmm.
it's always nice if you have one.
Mm-hmm.
It's just
Mm-hmm. Mm-hmm.
without paying the luxury
Right.
of having that, right? So
Uh-huh. Uh-huh. So, but for example, if we ask the patient to pay for interpreter, some of them, if they don't have money, they would say no.
right,
Like, no, I will not pay. So
right,
I will not need interpreters, but I will manage by myself.
right,
But sometimes it's not really good idea because like this can create some, communication problem.
right, right. It's more
So,
stress for the doctors, the nurses,
uh-huh,
and the
uh-huh,
patients as well,
uh-huh.
probably.
Yeah, yeah, yeah. So for residents, um, how can I say? We don't ask any money. Like they are treated as same as other Japanese.
Mm,
And I think it's good idea because they need help
right.
and they should be treated equal. But for tourists, I think it's better if we can charge them.
Right.
I mean,
Right.
it doesn't,
Because that's a huge benefit for them, right? I mean, if they can get translation, right?
Yeah, and maybe like they need more interpreters, because they have no idea what we like, for example,
Right.
in Japan, what Japanese people are talking about.
Right. Right.
So I think it's better if they can use the medical interpreters.
If you're going to
But
have any interpreter here as a tourist, probably a medical one is probably the most important, right? Shopping and
yeah,
other things probably are not necessary,
uh-huh,
but
uh-huh. And even if you are living here, because this happens to me when I was living in UK. So like just 2 months after I started to living in UK, I got the shingles. And at that time, my English was still not very good as now. And then before visiting the doctor, I searched what I might have. So
right.
I already, found I might have the shingles.
Right. You
And
self-diagnosed yourself
yeah,
then,
yeah, I
right?
self-diagnosed. Yes. And then I went to see the doctor and I could get that she said like I have shingles
Okay.
as predicted. But for example, like she also told me like when I enter, she asked me like, how may I help you today? And can you sit down? And can you show up the shirt and show me the belly? And these kind of processes, I couldn't really understand.
Right.
And
Right.
when you are sick, like you don't have, you cannot, how can I say, think as same as when you are fine.
No, you're not thinking as clearly as if you're,
Uh-huh,
you know,
uh-huh, uh-huh.
healthy. Yeah.
Yes, yes. So even if when I was healthy, I still, couldn't understand English. So that was worse. I got sick and I had to visit the doctor by myself. And then I had to understand what she's saying or like after I got the prescription, I went to the pharmacy and pharmacist explained me how to take the medicines, but like it was very like tough for me to
Right.
handle.
Yeah, it's quite daunting. I mean, there's so many things that you need to be able
Uh-huh.
to understand, and those things,
Uh-huh. Yeah.
questions that you're asked.
Uh-huh.
Like many questions in Japan don't require a real answer, or
Mm-hmm.
but
Yes, yes.
with medical things, yeah,
Mm-hmm.
usually you need to give them some kind of clear
Mm-hmm.
answer or straight answer.
Yes,
Yeah.
yes, yeah. So that's why I decided to become a medical interpreter
Okay.
because of my experience in UK.
Definitely. Yeah,
Yeah.
that's a good motivation to do
Yeah.
that. So one of the other questions I had was, the the AI boom that's going on right now. Has AI affected your job at all?
So far, I haven't felt any influence of AI inside a hospital. Only recently some companies they made I don't know if it's AI or just machine translator, but like some companies provide these translation services.
Right,
So if you speak something, they immediately translate it into the target language.
right,
But still, speaking of medical field, I feel the accuracy is not um very high.
right, right. And this is live that you can speak directly into these things and they interpret. Yeah,
And especially I feel Japanese is one of the language, very difficult language to translate.
yeah,
And because, for example, how can I say? Mm, when you work as a medical interpreter, your job is not only translating or interpret, like it's not translating, but more like interpreting. And you have to know or you have to guess what this speaker is thinking.
right. You have to read the situation and kind of
Yes.
understand their
Uh-huh.
mental state and physical state as well, I guess.
So even if doctors say it's okay, maybe it's not okay. And
Right,
this is very common among Japanese people because
right,
they don't really like say clearly, you know? They say, for example, if I can eat, let's say like the patient asked the doctor, if I can eat hamburger, and then doctor say like maybe you can eat, but it's better to avoid.
right, right.
But if we consider about the patient's health,
Yeah,
the patient shouldn't eat a
right,
hamburger.
right.
So
And
these
do you
kind of
often get that? I mean, in terms of the recommendation that the doctor is giving you versus your actual, like you have to interpret what the
yes,
doctor
uh-huh.
is saying, obviously, and you follow their
Mm-hmm.
lead. Um,
And also because we have different cultural background. And then I got I came up with one example, good example. So let's say there is the patient coming from US.
right,
This patient just arrived in Japan to live there. But since he has been sick and he's possible diabetes patient, so he went to the hospital. I'm just creating this story.
right,
And then after seeing the doctor recommended him to see the nutritionist. And this nutritionist asked him, because this patient said like, I used to go to McDonald's and eat a lot of like hamburgers or like I used to go to there every day. So nutritionist asked, how much of soda do you drink every day? And then this patient answered, it's just like medium size of Coke. And then medium size of Coke in US, I searched earlier, and it's 621 milliliter.
that's a medium, right?
Right, medium size. And medium size of Coke in McDonald's in Japan is 355 milliliter.
Right,
So even if they say like, it's just medium size, the amount we think is completely different.
right, right.
So you also have to know like there is the cultural difference,
Yeah, and
even if
size
there's
difference and
a size difference exactly. So like I mean, this is very easy example. So
right,
maybe AI can learn and remember like in US this is like double size of Japanese size.
right,
So but there are lots of things like this.
right. There's a
So
lot of technical, very specific
uh-huh,
ones that maybe are beyond AI's
uh-huh, uh-huh.
comprehension, right?
Yes, yes, yes. So because of that, I feel like, and also, for example, when doctor has to tell something serious, for example, like um maybe about the life expectancy or these
Right.
kind of things,
Very
I
sensitive.
feel, yeah, it's very sensitive topic, and I feel like AI cannot really substitute for human beings,
Right, right,
and because they can tell what the doctor say, I mean, they can interpret, but it's more like translation than
right,
interpretation. And that feeling the patient is having, AI cannot share, or the
right,
AI can pretend as if they understand, but they are not
right.
really understanding.
There's no empathy
Uh-huh.
with
Yeah.
AI. Yeah,
So in these situations, I feel like we need human interpreters.
definitely.
Mm-hmm. So I feel like more for translation, it's easier to be taken over.
Yeah,
And
with straight like written words probably and those
mm-hmm,
kind of things, definitely
yes.
AI is probably
Uh-huh.
faster and more useful, but
Uh-huh.
interpretation, especially for medical
Mm-hmm.
related sensitive issues,
Mm-hmm.
it's not
Mm-hmm.
really an option. Yeah.
Yes. Uh-huh. Maybe only like people who don't like human contact, AI can, become as interpreter. But yeah, for example, when you work, I mean, when I work as a medical interpreter in the hospital, I also make the medical certificate, medical
Right.
report. And I had to translate the
Yeah.
medical report. So in this case, I sometimes use AI because it's much easier and
Right.
faster.
Right. And it's a
And
report, so it's yeah.
it's like time effective,
Hmm.
I would say. Yeah. So I can reduce the time I have to spend for translation, but I can more commit to the patients inside
Right.
the hospital.
Because the most
Mm-hmm.
important one is the verbal
Mm-hmm.
interpretation, not so
Yeah.
much the reporting,
Mm-hmm.
right?
Mm-hmm.
Nice.
So, mm-hmm.
Yeah, good examples, and it's good to know that AI is not going to take over your job anytime soon.
Yeah, not anytime soon. I feel it's very difficult to be taken over.
So,
Mm-hmm.
like you're transitioning over to be a freelancer now, right?
Yes.
And
Mm-hmm.
like in general, what kind of work are you looking for, and what's your kind of specialty in that area?
Mm. So currently, I'm looking for a job that I can work as a medical interpreter, but remotely.
Right, because
I
you're
mean, mm-hmm.
kind of settled in Hokkaido there in Sapporo, right?
Uh-huh, uh-huh.
And are there a lot of options for remote work in general for freelancers, medical interpreter freelancers?
I feel I see more companies that provide this remote interpreter service around the world. And in Japan as well, like there are some companies that provide this service, but not many, I think.
Right.
So outside Japan, I feel like there are more companies.
Hmm.
And but I was hoping maybe some international company can start, like start, you know, becoming base in Japan.
Right. Right.
Uh-huh.
Yeah, I don't focus too much in the medical sector, but I do know there are a lot of companies coming in for nursing or
Mm-hmm.
elderly care or those kind of things.
Mm-hmm.
But and a lot of them are from overseas that are looking to come into Japan and kind of develop. So hopefully, yeah, definitely the market will pick up for that. But
and because like there are still not many hospitals or clinics that that sees non-Japanese speaking patients actively.
right,
And the problem is like they cannot hire interpreters as full-time.
right,
But if we consider about the patients, like possible patients, it'd be better if they can go any clinic or any hospital that they want to go,
right.
and they can still receive this interpreter service. So I feel there is the big market of medical interpreters.
Definitely,
So,
yeah, definitely. That's a needed, a much needed profession there.
and since like the number of how to say like international residents is increasing in Japan.
Right. Tourists and
Definitely,
residents is both. Yeah.
exactly. So definitely we will need more I'm gonna say setting that can provide medical interpreters immediately. So the difficulty is that patient cannot predict when they are going to be sick, you know?
True. Life happens. Accidents
Yeah.
happen, right?
They cannot say like, hey, tomorrow I will be sick and I will go to the hospital. It's not like that. Like they suddenly get sick, like they can get heart attack like suddenly middle of the night, and they need an ambulance and they have to go to the hospital. And then they need a medical interpreter. It's
Right.
like that.
And you were saying that there are a lot of opportunities for international medical interpreters because of the time difference and those kind of things as well.
Mm-hmm.
So it's not just restricted to Japan.
Mm-hmm.
If they need a Japanese interpreter
Mm-hmm.
in another country, then that's
Mm-hmm.
also an option as well.
Right.
Well, definitely. Well, thanks for sharing your insights on your kind of career and what you do as a medical interpreter. So,
Mm-hmm.
if there is anyone that is interested to speak to Emiko about
Mm-hmm.
her job or opportunities within the medical interpretation field, feel free to reach out to her on LinkedIn, as well as if there are companies that are open to reach out and in need of a medical interpretation services, feel free to reach out to Emiko. So definitely thanks for sharing your insight and about your passion and kind of career.
Mm-hmm.
And yeah, look forward to following up again soon.
Yeah, thank you so much. Thank you for having me today.
Thanks, Emiko.
Thank
Bye.
you.